Discover the best in local business news with a subscription to the IBJ and Inside Indiana Business. For a limited time, try us out for just $1 a week for 8 weeks. Claim this limited time offer now at ibj.com/trial offer.
You're not supposed to feel this way. You should be stronger. You should have it figured out by now. Everyone else is doing fine. You should be stronger. You're such a mess. You should have it figured out by now. No one would understand.
Those voices in the head are real issues many people who call Indianapolis home are dealing with. Mental health, the biggest challenge facing 1 in 4 who live in Marion County. Not the only issue in the latest assessment of health in the county. Longtime director of the Marion County Health Department, Dr. Virginia Caine, breaks it all down and the impact it has on the economy on this edition of the Business and Beyond podcast. And I'm pleased to be joined by Dr. Virginia Caine. She is the Director and Chief Medical Officer of the Marion County Public Health Department here in Indianapolis. And Dr. Caine, always a treat to see you. Thanks for joining me.
Well, thank you. It's always an honor to be able to get on your show.
Yeah. Well, what you just released a study, a survey that is done, a community health assessment that I think is done. What, it's done like once every 5 years or so?
It's done every 4 to 5 years. That's correct.
Okay. So this is a pretty big deal when it comes to health and wellness, and it gives you kind of an assessment, if you will, of the community, the health and mental health of the community. As you look at this report, very in depth, what stood out? What's your big takeaway from the report?
I think the big takeaway from the report was that the number one issue that the whole community identified was the major health issue for this community was mental health and well-being.
Mm-hmm.
That was number one, hands down. So 1 in 4 of our Marion County residents reported that they had been diagnosed with depression. But another 19% of our residents reported symptoms of anxiety.
Wow.
And we've unfortunately seen an increase. There was a 10% increase in our suicide rates for the county from 2018 to 2024.
Is that so? Maybe not a surprise that mental health would be identified as that number one issue, but did those numbers and the increase in suicides, those numbers kind of hit home?
Yeah, I think it really hit home. I think, there's a lot of uncertainty, I think, for a number of our residents. We've had a lot of changes that have happened since the COVID-19 pandemic. And I think this creates a lot of uncertainty for folks. And so that can increase their anxiety. Do I have stable housing? Can I afford to pay my electricity bills and whatever? Am I concerned about my children? Are they safe? And then, sometimes children, they can pick up the tension in the families related to a lot of our residents. And we're seeing an increase also in our homeless populations. People, for whatever reason, have issues of homelessness. And, can I stay in a shelter, or is enough capacity for a shelter? And so I think all of those play a role.
Yeah.
Why we're seeing this mental health has been a number one issue.
What you mentioned housing, and as we get around the state with our Innovate Indiana series, every community, every region we go in, housing is either the number one or number two issue in that community. And this actually came out, you're doing a health assessment, but housing came out as a big issue.
Yes, so this is the first time in the history of our health assessments that we ever had a issue that was not a health condition. This was a social determinant of health criteria. And so safe and affordable housing came out as, believe it or not, the number 3 issue in our community identified. We saw that 40% of calls to 211 in Marion County in 2023 were related to housing. 40% of the calls going to 211. And we have to understand that in Marion County in 2023, we estimated that about 49% 9% of people are renters, and 19% of homeowners, they both spent greater than 30% of their income on housing. And so we've also seen a huge rise in the cost of the value in Marion County rose $121,000 from 2014 up to 2023. So we've seen almost 103% increase in cost. And so, renting an apartment, buying a home, an extensive amount of cost, but yet with inflation, a lot of times our jobs and our salaries are not able to meet this increased demand.
As you look at it, because a lot of people are trying to get their arms around this housing issue in communities all over the state, do you see any relief or any things that are happening now that give you optimism that things will get better, or do you anticipate it could even be more challenging?
I think we got a lot of optimism. I know the city of Indianapolis has this wonderful program where they're getting folks who are homeless into stable housing, and they're working on that order. Now, the issue may be, though, we have to understand that for a number of the homeless, maybe as many as a third of them, they have like a dual diagnosis. So they may have some mental health issues and may need treatment, diagnosis, or screening related to that. So it's a very complicated process, but we have to build the capacity. And I know that our state policymakers is allowing funding for us to build what we call these low barrier shelters where folks can get out and be in a safe haven. So, you may have a mother, she's got children, sleeping in her car, but trying to figure out how to take a shower, get my kids dressed to go to school. Sometimes if our shelters are overwhelmed.
Yeah, as you look at that, and it makes me think scenarios like the one you're just talking about. Indianapolis, generally speaking, Indiana, from an economy standpoint, has been doing, fairly well. But there are a lot of those stories, like you mentioned, that really don't get attention, and the kind of the general public maybe doesn't have a keen appreciation for what's going on. As you kind of dig down a little deeper. Is that a challenge that not enough people maybe understand what's going on?
I think that's a huge challenge. So, you may be doing fantastic. You've had a job that you might have been in 10, 15 years, and all of a sudden you get a notice to say that your organization is reorganized and you downsize. So now I may have been in a stable job for 15 years and I no longer have a job. And I may be a single mother or maybe a single father, and I've got to figure out, wow, how am I going to pay my rent? What am I going to do about food and paying my utilities? And so you have a whole whopping different change in lifestyles. You're quickly trying to find another comparable job if you can, but that's not always possible, able to do it in a decent period of time.
Yeah.
And so sometimes folks are, through no circumstances of their own, they're hard, diligent, working folks may lose their job.
Yeah. As you look at issues like we're talking about here and homelessness and some of those other issues, and you talk to your peers, maybe in other states, other parts of the country, do you get a sense of how Indianapolis and Marion County is doing compared to other places around the country?
So there's some other cities like San Diego, other places that have done some innovative things in terms of addressing the homeless. And I'm hoping that we can band together. Folks in the construction business, folks who do development of low-income homes, we can get together and build that capacity that we need. We had several bouts of freezing, below freezing, and people are in tents outdoors because part of it, sometimes they're concerned about their own materials may be stolen or whatever in a shelter. So, and then some people may have claustrophobia, being in a shelter with a lot of people, high density related to that. So other cities have been remarkable in building that capacity, And Indianapolis, hands down, is the number one organization, is that the number one organization of collaboration. No one does collaboration better than the city of Indianapolis. And I believe no one has the heart and soul of this community and the humility that we have from so many of our folks really want to help someone who needs that help, especially when we see our children may be impacted in regard to this.
Yeah.
So there's no way we cannot solve this problem for the city of Indianapolis.
As you look at another big issue, certainly a health issue for a number of years, unfortunately, has been the infant death rate, the infant mortality rate in Indianapolis and Marion County. That rate higher than both the state and the U.S. average, especially high among Black or African American residents. Did this report shed any new light that there's been any progress or any improvement when it comes to infant mortality?
So here's what I will tell you is that we are realizing from this report that women are not getting in the first trimester of their care. So only about 56% of mothers in Marion County make it in the first 12 weeks of pregnancy. Sometimes there's a delay of diagnosis, especially if you have someone between 18 and 24 may not recognize that they may be pregnant. But also, we're concerned about losing our capacity to be able to see these pregnant mothers. One of these specialty areas that we're seeing a drop in is our OBGYN physicians. We need more OBGYN physicians, more family practice physicians willing to do obstetrics. And so that's becoming an issue in terms of the workforce capacity being able to be there. And so that implies that we have to have more alternative strategies in order to get them in the first trimester. So I may call you but if it takes me 3 months to get an appointment in to see you, I may have passed that first trimester of pregnancy. So we're going to have more alternative strategies in order to reach a lot of these pregnant mothers earlier.
Yeah. As you look, you've been outspoken about health disparities. Where do those disparities show up in most clearly in Marion County these days?
So I think part of the problem is it's no surprise sometimes to see these disparities pop up in those zip codes that has a higher poverty level in those zip codes, okay? And that you also may see those pockets where you may see pockets of food insecurity. You may see areas where transportation may be a tremendous barrier. And then we just have to understand we've seen a huge influx of new immigrants to our community who may not always know how to navigate our healthcare system. And we also have individuals, I think, unfortunately, because of the ICE event happening nationwide, may not actually are afraid to make an appointment, even though they may be here in this country legally and they may have a visa. They still may be concerned that they could be deported and so are not keeping their appointment. So these are the challenges that we have to face and figure out how we can, from a communication standpoint, be able to make them feel safe as they receive their medical care.
As you look at prevention versus treating the problem, and I think back to the role that food, that hunger plays in this whole health equation. And you were kind enough to participate in a really great panel discussion, the event that Gleaners and IBJ Media put on a few weeks ago. But are enough resources being focused on preventing health problems versus just treating the problems after they occur?
No, so I'm really going to tell you that I think prevention is the key. And I think we really have to focus on it. And I think we need to focus on it, one, just from an economic standpoint. So let's just take the person who may have a breast nodule in their breast, and they're concerned that they may have cancer. But I can't afford to pay the doctor because I've lost my insurance. And so we know that 1 in 3 residents reported that they had a medical bill that they were unable to fully pay. But even more important than that, 1 in 5 reported that they did not see a healthcare professional in the past year due to medical costs. So now I have this patient that's got this breast lump, doesn't have the money, concerned about going to seek care, lets it, instead of being a stage 1, where I could easily remove that nodule, inexpensive, person's life expectancy is, greater than 98% that they're going to live a full life, no problem, because they're in stage 1 now, versus that I've just come so sick, I don't have a choice now. I have to go to the emergency room. But now I've got stage 4 cancer. So now I require chemotherapy. I require radiation therapy. I require probably a significant amount of home care compared to if I had just caught that person in the stage 1 of their cancer from a preventative standpoint, and we're focusing and pushing that. So that's the difference between us and a lot of other countries that are similar to us, like Canada, Germany, France, and whatever.
Mhm.
They do focus on the prevention part, unlike us, and yet we pay double the amount of medical costs per patient compared to any other country, and our health outcomes are not as good as the other countries.
Yeah. Much more ahead with Dr. Virginia Caine on the Business and Beyond podcast. We'll talk about some of the major priorities coming out of this health assessment and what's next. That's when the Business and Beyond podcast returns. Stay with us.
As a bank, PNC prides itself on being boring. But the truth is they couldn't be more excited to serve the dynamic Indianapolis community. For nearly 160 years, they've quietly toiled away to deliver brilliant results for their equally brilliant clients. They have dedicated PNC teams throughout the local area all ready to do the boring work to help you unlock your own brilliance. PNC Bank, brilliantly boring since 1865. PNC Bank, National Association member FDIC.
We build Indiana. The Laborers International Union of North America builds and maintains roads, bridges, and other essential infrastructure that make us the crossroads of America. So thanks to LIUNA members' work, Hoosiers have a better quality of life, like access to utilities, easier routes to jobs, schools, or medical care, and deliveries keep moving. We build Indiana for good jobs and stronger communities. The Laborers International Union of North America. We are LIUNA.
And welcome back to the Business and Beyond podcast presented by PNC. My guest this week is Dr. Virginia Caine. She's the Director and Chief Medical Officer of the Marion County Public Health Department here in Indianapolis, and really a leader and a visionary when it comes to healthcare and the wellness of our residents. And Dr. Caine, we've been talking about this health assessment and some of the findings. It also kind of identifies, I think, some key areas, some key priorities going forward. What are those?
So number 1 was mental health and well-being. Number 2 was actually access to health care. So like nearly 1 in 5 residents reported that they were unable to access prescription medications, or they took less than directed due to the cost of medicine. So I'd have a patient who's got high blood pressure tell me, well, I couldn't afford to take all my pills. And so what I would do is I would just take 1 pill twice a week. And as physicians, healthcare providers, we know that you might as well not taking any pills, because you have to take the pills daily in order to keep your blood pressure down. But, people are trying to improvise and try to do the best they can related to what they have. As I said, affordable and safe housing was our number 3 issue. Our 4th issue was trauma, injury prevention. the gun violence still impacts people. 1 in every 4 residents reported that they personally know someone or a close family member or friends who were impacted by substance use. So with the trauma and injury prevention, we have a tremendous amount of firearm homicide rates that's nearly 3 times higher in Marion County than they are in Indiana in the United States. But fortunately, we've been seeing a significant decline just in the last year or two in regard to our homicide rates. But we still have a lot of work to do. And we have domestic violence that we have to consider also in our communities. And last, to round that off, is our infant mortality.
Yeah, yeah. As you look, so many things going on in the world of health and wellness, to be sure, and obviously, it seems like sometimes it seems like it was eons ago, but the pandemic and the challenges we all faced during the pandemic, and as we are entering March Madness here in Indianapolis, always a great time of year. The Final Four will be here before you know it. I think back to your role and so many others who were involved, but you had a key role when Indianapolis did what I think is one of the most amazing things ever in hosting the entirety of March Madness. The entire tournament was held here during the pandemic. And health was the number one issue facing everybody. And how do you do it and keep everybody safe? What do you remember about those days?
You know what? We had an incredible amount of expertise and talent assisting in regard to this. One, you had a mayor who believed in evidence-based intervention, so that was clear. That was very critical and important. But I also want to say that the NCAA, they had an advisory team. Their chief medical officer at that time was just phenomenal. And we worked in partnership with IU Health in terms of doing the testing for everybody. They were wonderful. And, we just had great partners. So our Indiana University, Fairbanks School of Public Health, at that time, Dean Paul Haverson, and the technical expertise where we were getting there. The Indiana Department of Health was on constant calls with us. We sometimes be meeting at 2:00 in the morning, making decisions about what was going on in regard to that conference. But you have to work with downtown Indy, the hospitality folks. You have to work with the convention committee folks. You had to work with everybody and every healthcare system. We were all on the same page, making decisions, making them every day. And we met every day during that whole Final Four. We met every day for at least a minimum of an hour or longer making decisions. And I really have to give credit to a lot of my team and the physician support I had. And so just everyone was involved.
It was amazing that it was done, that it happened and done so successfully. And you talk about decisions. You had to make a lot of decisions, some on the fly, and you were kind of flying blind in some respects. I mean, there was no blueprint to do this per se. What was that like? Were there ever any times when, you thought, oh boy, I hope this works?
Yes, because, you had the challenges of the teams itself, trying to make sure that they were doing the necessary prevention measures, quarantining, isolation, okay, and they just couldn't be roaming around all through the city. And so how do you, for their mental well-being, how do you keep them satisfied and that their mental status is okay? And how do you plan activities related to that? And so it was just a challenge that all of us were trying to be very vigilant about in regard to making this safe. And so I'm happy to say we had less than a 1% rate of COVID infection being transmitted for the Final Four in this event that I think possibly in the history of very large sports-oriented events.
Wow. As you think back on it, when you first heard this idea that Indianapolis was going to do this, what did you think? Because there are some people who said, that's crazy. How are you going to do it? It's crazy to think you're doing it in a normal time, let alone during the pandemic.
So I think the thing is that we're not about why you can't do it. We are on the premises, okay, we're going to do it, but now how can we do it? And how can we do it safely and feel comfortable that we're not going to have a big outbreak occur in our community as a result of this Final Four? And so when you look at it from a different perspective, it makes it easier for you to come up with solutions, alternative solutions in terms of making a difference. And I think the other thing is it's the amount of the trust that people have in your professionalism, your expertise. So a lot of the advisory committee members that NCAA had got their own medical advisory committee that they had gotten. So they had people from Johns Hopkins, they had people from Vanderbilt, so real well-known folks, but it was wonderful that I knew a significant number of those members because I collaborated with them on a national level on other federal committees. And so that, I think, can be beneficial and can help sometimes.
All right, as we wrap up, Dr. Caine, if every business leader, policymaker, resident of Indianapolis could do one thing to improve the health of the community, what would you ask them to do? Is there one thing that as a community we can do or should do, you think, to make the biggest impact on the health of the community?
So I tell you, number one, check out your own health. Do that for me. If you do nothing else, get that annual physical examination and check yourself out. And then listen to the advice of your healthcare professionals because you've got to have the right nutrition. You've got to do a significant amount of physical activity, and you got to get the proper sleep and hydration of fluids. But get yourself checked out. If that's the number one issue, that would be helpful. But here's the other number. Can I add a number two?
Yep.
I want you to identify one of these top issues that we've identified for the community and volunteer. Provide your technical expertise. Help us out. Help us with the solutions. Help us provide the resources that we know can make us the healthiest community in this country if you lend.
Good. Excellent. Dr. Caine, it's been a real treat to catch up with you, and the work you have done for so many years and continue to do is certainly a difference maker for our community. So thanks for joining us. I hope to see you soon.
Okay, well, thank you for keeping businesses very vibrant. We need that we need our employees healthy, and we knew that new economic sector can help benefit. A lot of education can go on in businesses for health. Thank you.
I agree. Thank you. Dr. Virginia Caine, she is the Director and the Chief Medical Officer of the Marion County Public Health Department. And thank you for joining us on this episode of the Business and Beyond podcast presented by PNC. We're a weekly conversation with achievers in business, sports, entertainment, and beyond. And you can download all of our episodes and get Indiana business news 24/7. All you have to do is go to InsideIndianaBusiness.com. I'm Gary Dick. Thanks for joining us. We'll see you next time.
Off the Record with Indiana's 250 most influential business and community leaders is a podcast that peels back the curtain on Indiana's most respected leaders, one episode at a time. Go beyond the headlines and hear the stories of grit and innovation that shape these leaders. Do you want to know who's driving our state forward? This is a must listen. Subscribe and listen wherever you get your podcasts or at ibjpodcast.com.
Do you want to know what really drives change in Indiana? You won't find it in sound bites, you'll find it in stories. Stories from CEOs, lawyers, coaches, entrepreneurs, and community advocates. That's the IBJ Media Podcast Network. Insightful, local, impactful. Find all of our shows by searching IBJ Media in your podcast app or visit ibjpodcast.com.